And joining us now is Dr. Conrad Tobert, a urologist with Corwell Health, to talk more about prostate cancer, the signs and symptoms to look out for.
Absolutely, Doctor. Thank you for being here. Now, the president's office says he has a Gleason score of 9. I'd like for you to explain what that means, and then I want to come back with a quick follow-up to that.
Absolutely. Thank you for having me on. A Gleason score of 9 is the assessment that the pathologist makes after they look under the microscope after his biopsy. There's two ways to do Gleason scoring. There's a Gleason score and a Gleason grade. I find it's easiest to actually understand the Gleason grade because it goes from a 1 to a 5, 1 being the least aggressive, 5 being the most. His Gleason 9 correlates with that 5 out of 5. So again, the most aggressive type of prostate cancer you can have when looking at it under the microscope.
One of the things I just want to make sure that we say before we move too far into this is that there are a lot of different types of prostate cancer, and that people shouldn't be afraid that theirs is going to be the most aggressive. There are some that are very slow growing, and the important thing is for people to be tested.
100% agree. Prostate cancer really is a disease that comes on a wide spectrum. So when you're diagnosed, you could be diagnosed again with the least aggressive, as we just talked about, or the most aggressive. And that's also where early detection is important, because when you can pick up this disease early, we have a lot of different treatment options to help cure patients from this disease. It's important to know that prostate cancer is the most common cancer that affects men, except for skin cancer. But it's also something that can be treated successfully when caught early.
And Doc, how many years does it take to develop?
That's a good question. It oftentimes can develop early when men are in their 50s and 60s, and sometimes it can actually be developing later in the 70s and 80s. We know a lot of men in their 80s can develop it just like the president did. And the true growth is, we also know it grows slowly.
What are some of the, and I know there are a lot, but what are some of the signs that might make you be concerned about prostate cancer, and when should you start being tested?
Another great question. Primarily, prostate cancer in its early stages is asymptomatic, which means you won't have any signs or symptoms, which is where screening and talking to your doctor when you're in the ages of 40 and 50 is very important. The best way to screen for prostate cancer is done with a blood draw, which is a PSA, the prostate-specific antigen, and a digital rectal exam, which allows the doctor to feel your prostate to look for any abnormal findings. President Biden had his detected with that digital rectal exam because he was having urinary symptoms. We know as men age, the prostate can impact the flow of urine because it can pinch off part of the urethra. So when you start developing symptoms concerning for slow stream or things of that nature, it's very important to talk to your doctor and have a discussion about screening for prostate cancer.
Talk a little bit more, the risk factors for prostate cancer, the most common risk factors.
Prostate cancer is very common. 1 in 8 men in their lifetime will be diagnosed with prostate cancer, but we know some of the other elements can make people more at risk, specifically if you have a family history. If you have a family history of a father, an uncle, or a brother, those make you more susceptible. Race also unfortunately plays a role. African Americans are also more likely to develop prostate cancer. So with a higher family history or a racial component, 1 in 6 men can be diagnosed. So again, a very common disease.
And finally, and we don't have a lot of time left, but I think it's important to talk at least briefly about some of the treatment options, because it isn't necessarily one size fits all.
Absolutely. There are different ways to treat prostate cancer. With President Biden, his disease is metastatic. So unfortunately, there is more disease than just localized to his prostate. And that's where the hormonal therapy that was mentioned in the segment a couple seconds ago can be utilized and successfully treat patients for many years. When it's localized to the prostate, one can undergo surgery to treat the prostate. One can have radiation to treat the prostate. And in some situations, when it's not as aggressive, active surveillance can be utilized to monitor the disease over time to make sure it stays inside the prostate and never actually impacts the patient's life expectancy.
All right. Dr. Tobert, thank you so much for being here with us.